Good afternoon. My name is AMOS. Today I'll be speaking on hand hygiene and the importance of it in regards to working in a healthcare environment. Throughout the presentation, I'll be discussing what is hand hygiene, statistics of hand hygiene, the risks associated with not performing hand hygiene, when hand hygiene should be performed, and the products that will be used. Statistics. An interim benchmark of 70% of hygiene reporting on my hospitals has been advised by the Australian Commission on Safety and Quality in Healthcare. It is estimated that around 200,000 HIAs in Australian hospitals each year. It is possible to reduce HIAs by using effective infection prevention practices such as improving hand hygiene compliance. Teaching people about hand washing helps them and their community stay healthy. Hand washing education in the community reduces the number of people who get sick with diarrhea by 31%, reduces diarrheal illness in people with weakened immune system by 58%, reduces respiratory illness like colds in the general population by 16 to 21%. Data has been collected nationally from a total of 168 hospitals from both the public and private sectors. The average compliance of staff and people that regulate with hand hygiene was 63.5%. Queensland has undertaken a successful hand hygiene initiative in state public hospitals for some years, using a different compliance measurement process. Queensland will be using the 5 most measurements onwards. So this is a graph that with people that were in the healthcare system that were compliant, non-compliant with hand hygiene regulations. So before touching the patient, after touching the patient, before performing an insert position on the patient, after removing gloves, after contact with body fluids. Risk associated. One of the risks associated is the flu. The flu mainly causes fatigue, headaches, coughing, and much more. But flu can also be spread through contact with contaminated surfaces. This is why it's so important to wash your hands to avoid these diseases and sicknesses. Microorganisms are readily transmitted on healthcare workers' hands. Germs are also a risk that is associated. Germs from unwashed hands can be transferred to other objects like hand trails, table, toys, and then transferred to another person's hands. Removing germs through hand washing therefore helps prevent diarrhea and respiratory infections, and may even help prevent skin and eye infections. Diseases is also a risk associated. A number of infectious diseases can be spread from one person to another by contaminated hands. These diseases include gastro infections, such as salmonella, respiratory infections, such as influenza, and respiratory infections. Washing your hands properly can help prevent the spread of these germs, like bacteria and viruses that cause some diseases. Some forms of gastro and respiratory infections can cause serious complications, especially for young children, the elderly, or even those with a weakened immune system. The next thing, so when hand hygiene should be performed. Hand hygiene should be performed to protect patients against infectious agents from the hands of the healthcare worker, and help to protect patients from infectious agents, including their own, entering their body before and during a procedure. So mainly, most of the times, hand hygiene should be performed is before touching a patient, before a procedure, after touching a patient's surroundings, and hygiene must also be performed after the removal of gloves. Products to be used is soap, water, hand dryer, paper towel, hand sanitizer, as well as alcohol rub, and gloves. Research has shown that improving hand hygiene compliance is about human behavior, organizational culture, and in leadership requires a multi-phase approach to achieve improved hygiene compliance. So it is recommended to always wash your hands in order to prevent someone from getting sick or catching on to a bad sickness. Thank you, and I hope you all enjoyed this.